Of course, that's the goal of this. Yes, there's something you can do. Stop and modify your risk factors. If you're a woman or the husband, or you are, if you're affected, or you're a woman, sorry, stop smoking, change your diet, exercise. And if you are a husband or a brother or a son, well, talk to them about this and tell them, hey, mom, hey, honey, you should change your lifestyle. You should quit smoking, because I want to be with you for many, many years. And this is so easy. And I don't want you to be one of those 4,000 women. There are two things that are very important with that. And I chose to deliver that in a different, in a separate, page, is that right now the risk and the assessment we do is with the pap smear and the prevention through the HPV vaccine. Yes, the HPV vaccine should be administered to women starting age 1 up to 22 years old, and even more if they are immunocompromised, having HIV or other disease that might affect their immune system. They can have it up to 27 years old. A lot of controversy has arisen with the vaccines and the vaccine movement, and it's not the subject of today, but I'm just telling you, the data shows it is very safe and it is saving lives. So I totally recommend it, and I hope you do it. It's not too late. Why 11 years old? Because the vaccine is more effective if the woman has never had, or man, because this is also available for man, never had a sexual relationship, sexual intercourse. So it is better. I mean, they chose 11 years old like a starting point. But even if you're 16, 17, 20, and you can still do it, and data shows it still prevents. Not as good as if you had it at 11, but it will help you. So please remember, it's very safe. It's very, very safe. The pap smear. This is the best strategy we have for early diagnosis of cervical cancer, and it's the thing that you should do in order to be sure that you don't have it, or your partner doesn't have it, or your relative. It is also controversial in a certain way, or at least a taboo. Certain women don't like to do it. Certain women say it's painful, very uncomfortable. And what do I have to say about that? Well, it's definitely not a comfortable exam. That is very clear, because cervical cancer is on the genital area. So of course it's going to be a certain discomfort about it, but it does not necessarily mean it has to be painful. I mean, you have to build a very professional relationship with your doctor or your nurse, and I'm pretty sure they will be able to perform it without any pain whatsoever. Who should do it? Starting age 21 and until 65. If you've never have any abnormality, you can stop at 65. If you had, you should do it until 10 years after the abnormality appeared. So what does it mean? That maybe you were 50 and they found 60, and they found something abnormal. They treated and now you have nothing, but that means you don't have at 65, but you need to extend that period till you're 70. But if you are between 21 and 65, you should do it at least once a year. And starting at age 30, the pap smear has to be, or at least is recommended to be done with the HPV screening test, which is done in the same sample. So it is something the doctors and nurses here in the United States are taught how to do, and they will do it for you. But even if they don't ask you, you are supposed to ask, because this is your health and this is available for everyone. This is very, very, very important.